Hi, this is Kelly McClendon from Compliance Pro Solutions, and I'm going to finish today Hot Topics, HIPAA and Information Blocking, Interference and Exceptions. So information blocking is to interfere with or provide interference, which means to prevent or materially discourage or otherwise inhibit free flow of information upon request, typically from a patient, but that's going to expand quickly to other parties. Information blocking is business, technical, or organizational practices that prevent or materially discourage access, exchange, or use of electronic health information when an actor or provider, payer, or an EHR developer knows or should know these practices are likely to interfere with the access, exchange, or use of EHI. Some of those are examples would be like delaying an access or an exchange, or charging costs where you can't, or exorbitant cost. What's not considered interference, you don't have to violate your business associate agreement or service level agreements, but you can't use a business associate agreement in a discriminatory manner to forbid or limit disclosures that are permitted under the privacy rule. That's pretty technical, and we won't get into it. Educate patients about privacy and security risk of using applications and applications from third parties. Uh, that's something you're going to have to do, but you're going to have to just focus on current risk, factually be accurate, unbiased, objective, and not unfair or deceptive. You got to provide it in a non-discriminatory manner, means you can't discriminate against third-party apps that might not be from your organization if you're a provider. But that's not considered interference if you talk about uh, applications that might be getting the information for the patient, but you've got to be very careful with how you do that. So provider organizations are scripting those kind of interactions, which are going to happen more and more over the next couple of years. Information blocking will almost always be implicated if a practice interferes with a patient who seeks access to their information or exchange or use of their EHI. And that can include charging fees, either where you shouldn't or too much fees. Providers or other authorized individuals having EHI when and where they need it, especially for clinical purposes. Payers and others that purchase healthcare obtaining information they need. Healthcare provider access, exchange, use, and EHI for quality improvement and population health management and public health and patient safety needs. These are things that if you interfere with these, then likely it's going to end up being an information blocking practice that you could get in trouble with the Office of Inspector General for. Somebody can complain into their complaint portal about. Time frame for access for patients to get their EHI. If you're going to invoke an exception, we're going to talk about those in a few minutes. Only in the infeasibility exception has a 10-day time frame on it. There's 7 other exceptions that you might invoke to say what I'm doing is not information blocking because it comes under one of these exceptions. But as we looked at the time frames for those exceptions, only one of the 8 exceptions has a time frame, and that's what's called the infeasibility exception. And they have not really said what timely access means. They've left it open for the regulators to decide on a case-by-case basis. So be very careful with that because that doesn't give you much wiggle room. So I don't know, but I would suggest at this point that if you're going to invoke an information blocking exception, 10 days is probably a reasonable timeline for any of them. It's required for the infeasibility objection, but otherwise I would probably apply that time frame as best you can to the other ones as well if you want to invoke an exception. We'll talk about that more in a minute. Response to requests for access to patient EHI. So all requests for right now from the US CDI, we talked about that in another presentation, For any data elements within the US CDI, US Core Data for Interoperability, in electronic format, this is a request to have electronic format, have to comply with the request and provide timely access, like we talked about, for getting the patient their information. But it's a lot less than HIPAA gives you, which is 30 days now, although with the new HIPAA rules, it could go to 15. Therefore, a request for access that fits the timing must be identified and acted upon, let's say, in a 10-day time frame, which began April 5th, 2021. So if a patient asks for information from you, get them their information within 10 days to stay out of trouble with everybody, or invoke an information blocking exception. On October 6th of 2022, it's not just for US CDI data elements, but then it becomes any EHI that you have in a designated record set about the patient, not just the US CDI data elements. That's really a big deal. That means any type of records you're keeping on the patients that are in your designated record set will have to be provided in a timely manner to the patient. So we've got a little wiggle room for that bigger set of data for the patient than the US CDI, but not a whole lot. So be very careful and start working to define what other data classes you have, which are types of information that a patient could request that you have about them. And in the background, some of us are doing work on trying to advise the Office of National Coordinator for Healthcare IT, or ONC, what those might look like as far as those data classes. So there's a lot we don't know about the rules now. We're just learning how to use them, but we're already working to get some clarity on some different points that's hard for everybody to understand. There are 8 information blocking exceptions. It means if you're not going to provide access to a patient and later other parties that are asking for patient information, you can say, hey, I'm not going to give it to you because I've got a privacy issue or a security issue, or we believe it'll cause harm. We believe it'll cause our IT to have problems, slow down, not be able to perform. We think it's infeasible for us to give you the information. We don't have it in a way we can give it to you. There's a licensing exception, a cost exception, and a content and manner that we don't know how to give the information back to the patient in a format they're asking for. So these are all a complex set of rules that each of them has certain provisions you have to, or conditions you have to meet before you can invoke them as an exception. But privacy exception, an example, very simple example, might be that somebody has requested information, you don't have a valid ID for them, and so you're not going to release the information without that, and yet you have run out of time to get to that request, let's say 10 days, even though it's not in stone. Let's just go ahead and see if that's a best practice. Then you'd want to invoke the privacy exception. You'd say, we cannot give you your information because we do not have valid ID. We're going to invoke the privacy exception. Now, if they cure that later, sure, you're going to have to give them the information, but that's kind of how it works. Content and manner, maybe they're asking, or infeasibility, maybe they're asking for information in a format you can't provide, then you would have to. But each of these has conditions that you have to meet that are fairly complicated. I've created documents that work on that, so if you need more guidance on how to manage your information blocking, invocation and revocation, let me know, and I can help with that. So in conclusion on this set of presentations we've done, for your regulatory compliance, keep doing what you're doing right now for privacy and security, and assume HIPAA doesn't change for now, but watch for updates, because over the course of 2021, we probably will get changes. Then it'll be implemented later in 2021, probably. Remember that HIPAA, information blocking, and interoperability rules work together. That at any patient access request, patient is requesting access to their information. That's all continuing to evolve and is a really important topic for any provider of care, anyone that makes copies for patients to understand and apply correctly. Got to learn the new requirements coming with and in place in some respects for the new 21st Century Cures Act and information blocking. Get your processes refined now. Work with your IT and your EHR vendors. Work with your IT and your EHR vendors now to understand what they're doing to meet the information blocking rules they have to meet. If you are impacted by 42 CFR Part 2 substance abuse, that's synchronizing with HIPAA, so be sure to implement those changes and watch for more changes and maintain vigilance about newly arising security threats and vulnerabilities and respond and document your response in real time. We always have to say that because there's so much of that going on that we've got security threats. They all change, your vulnerabilities change, so stay on top of that. I want to thank you for your attention, and should you need to contact me, feel free to do so. And thank you very much.